Hey everyone, back here with another episode discussing all things podiatry. I wanted to first take the time to thank everybody who subscribed to the channel. If you haven't done so already, be sure to show some support. Now, let's get straight into it. Today, I wanted to talk to you about a condition that affects nearly 1 in every 10 people. A condition that could be so painful that it has even sidelined world-class athletes such as Super Bowl champion Peyton Manning, future Hall of Famer Albert Pujols, 6-time All-NBA team selection Jason Kidd, Olympic soccer medalist Aaron McLeod. What is this condition, you may ask? Well, it's none other than plantar fasciitis. The plantar fascia is a band of tissue that starts at the heel bone and extends to the base of the toes. Plantar fasciitis is an inflammation of this structure. Now, how does this condition present? People will typically complain of heel pain, usually in the first step of the morning. Pain after long periods of sitting or standing, pain in the arch, pain not necessarily during, but after exercise. What causes this to happen? Well, it can vary. Foot types such as having a high arch or flat foot have both been attributed to this condition. Improper shoe gear is a huge factor, especially flats and flip-flops that lack proper support. Certain types of exercises that place too much strain on the plantar fascia will do this as well. Jobs that require prolonged standing, weight gain or obesity which increases the load on the plantar fascia can cause this as well. Now, if you suspect you may have plantar fasciitis, it's crucial you see a doctor about it. Why? Well, the doctor will have to do two things. The first thing is rule out any other diagnoses that may mimic plantar fasciitis. Things such as a stress fracture or a heel cyst. The second thing is to formulate a treatment plan that's right for you. Now, there's an array of treatments out there for plantar fasciitis. Things such as physical therapy, rest, ice, anti-inflammatory medications, stretching, and the list goes on. But treatment isn't always clear and cut. The professional will have to formulate a treatment plan that best suits your needs. So, for that reason and much more, it would be wise to see someone about this. Now that wraps up this segment. I hope you enjoyed it. Until next time.